Hi everyone, I'm going to teach you how to do a trigger point injection, a procedure that is simple and yet one of the most rewarding things that you could do in taking care of a patient. We're now going to review 6 aspects of a trigger point injection: indication, location, equipment, medications, injection, and aftercare. Trigger points are painful knots in your muscles. A trigger point injection can help soothe muscle pain from head to toe in the neck, upper back, arms, and legs. It is helpful for tension headaches, fibromyalgia, back pain, sciatica, and myofascial pain. You need to select an area that is away from the lungs. One of my patients received an injection to the anterior shoulder at a clinic and ended up in the emergency department with a pneumothorax. Know the boundaries of the lung, above the clavicle and below the sternal notch. The equipment you need is simple, just 3 things: a 10cc syringe, skin prep, I like using ChloraPrep, and a needle. I most commonly use trigger point injections for the low back, so I use a 27 gauge long needle. If I was injecting to the back of the neck or other skinnier areas, I would use a 30 gauge short needle. There are various options for trigger point injection medications. You can inject corticosteroids, normal saline, Botox, and even dry needle without any medications. I like using 50% lidocaine, also known as xylocaine, and 50% bupivacaine, also known as Marcaine. I say lidocaine is for me because it works right away and I'm impatient and want to see the medication work instantly. And the bupivacaine is for the patient because it lasts about 6 hours and helps the patient longer. Draw up the medications into a 10cc syringe. It doesn't matter which medication you draw up first, the lidocaine or the bupivacaine. I'm drawing up 5 cc's lidocaine and then 5 cc's of bupivacaine. It doesn't have to be exact. I safely discard the drawing needle and replace it with the 27 gauge long needle that I'll be using for the injection. I tell patients kind of like going to the dentist and the dentist numbs up your tooth before they drill on it and you don't feel anything. Using the same kind of medications but for your muscle. Okay, so now we're ready for the injection. We have our 50% lidocaine, 50% bupivacaine. Tell me, sir, where it's hurting you the most with your finger. Point to where it's hurting the most. Right there.
Right there.
Okay. All the way down. Okay. So even though it's radicular pain, numbing up just this area is also very helpful. So right where it hurts, I want to know the spot that really hurts. I clean it really well with the cleanse. I also like to clean my finger so that way I could touch it and not contaminate the area. And I am going to put it right in there. There's no harm. There's no vessels or nerves or anything that could be a problem. And I will put in about 3 cc's. There's not a hard science as to how much you do. After I inject, I rub it really well into the area and ask my patient how he feels. It should really work right away. And I have more medicine to use in other spots because usually this goes away, but then it hurts somewhere else. I used up my 10 cc solution, injecting about 3 cc's at a time to the areas directed by my patient, in the buttocks and in the leg. What do you think?
3, 4.
Oh my goodness, we went from a 10 to a 3 or a 4. Magic, huh? I write down trigger point injection with lidocaine and bupivacaine as part of my aftercare instructions. This is helpful in case my patient wants the same procedure in the future or to communicate to other providers what I did. While bupivacaine lasts 6 hours, the pain relief caused by breaking up the pain cycle and relaxing the muscles lasts longer. I like doing this better than pain shots because you instantly feel better, right? I love having happy patients.